I want you to think about the last time you felt genuinely confident walking. Not just shuffling from room to room with one hand on the furniture. Not carefully picking your way across a parking lot, watching every crack in the pavement. I mean actually walking, freely, without doing math in your head about every step. Watching every crack in the pavement. I mean actually walking, freely, without doing math in your head about every step. Without that quiet fear that's probably been building for months, maybe years, that one wrong move and you're going down.
Without that quiet fear that's probably been building for months, maybe years, that one wrong move and you're going down.
If that confidence is gone, or if you can feel it slipping away, I need you to stay with me for the next 10 minutes. Because what I'm about to explain might be the most important thing nobody has connected for you yet. Because what I'm about to explain might be the most important thing nobody has connected for you yet. There are two things going on inside your body right now that are actively working against your balance, your leg stability, and your ability to move through the world without being afraid. The first is that the magnesium supplement you're probably already taking is delivering almost nothing to the nerve and muscle tissue that actually controls your coordination. The second is a vitamin combination mistake that's extremely common in adults over 60. And it's causing calcium to pile up in the wrong places inside your body while the nerve pathways that keep you upright stay starved of what they need. Put those two problems together and you get something that looks like aging. But it's not aging, it's a fixable nutritional mismatch. I'm Dr. Frank Castle. I practice integrative and functional medicine, and I've worked with hundreds of older adults. Before we go further, drop a comment right now. Your age, where you're watching from, and whether your balance has changed in the last 2 years. I read everyone, and if you're not subscribed yet, now's the time. Let me explain what balance actually requires from your body at the biological level. Because it's not what most people assume. Most people think balance is about strength, leg muscles, and sure, muscle strength matters, but the deeper system running the show is neurological. It's about how fast and how accurately your nervous system can figure out where your body is in space and fire off corrective signals to your muscles quickly enough to keep you on your feet. It's about how fast and how accurately your nervous system can figure out where your body is in space and fire off corrective signals to your muscles quickly enough to keep you on your feet. Now imagine the cables in that network are damaged. Not cut, not completely dead, but fraying, slowing down, dropping signals, missing corrections. What does that look like from the outside? It looks like hesitation, like shuffling, like grabbing walls, like a person who used to walk without thinking and now has to think about every single step. That's not weakness. That's a communication system that's no longer reliable. Your brain takes those signals in, processes them, and fires back instructions, compensate right, shift weight, steady. Now imagine the cables in that network are damaged. Not cut, not completely dead, but fraying, slowing down, dropping signals, missing corrections. What does that look like from the outside? It looks like hesitation, like shuffling, like grabbing walls, like a person who used to walk without thinking and now has to think about every single step. That's not weakness. That's a communication system that's no longer reliable. It looks like hesitation, like shuffling, like grabbing walls, like a person who used to walk without thinking and now has to think about every single step. That's not weakness. That's a communication system that's no longer reliable. And the main structural material that keeps those cables intact is the myelin sheath, built and maintained by specific nutrients that most people over 60 aren't absorbing in the right forms. And the main structural material that keeps those cables intact is the myelin sheath, built and maintained by specific nutrients that most people over 60 aren't absorbing in the right forms. Now here's the specific combination error I run into constantly. Vitamin D3 is essential for nerve function and calcium regulation. When you take vitamin D3 without vitamin K2, you're boosting the amount of calcium your body pulls in from food and supplements. That calcium hits the bloodstream, and it needs somewhere to go. Glutamine K2 is a traffic controller that tells calcium to head for your bones and teeth, where it actually belongs. Without enough K2 in the picture, that calcium doesn't go to your bones. It deposits in soft tissue, in arterial walls, in the tiny blood vessels that feed your peripheral nerves. Without enough K2 in the picture, that calcium doesn't go to your bones. It deposits in soft tissue, in arterial walls, in the tiny blood vessels that feed your peripheral nerves. When those small vessels calcify and narrow, blood flow to your nerve tissue drops. The nerves that carry your balance signals get less blood, less oxygen, and they become less capable of fast, accurate transmission. And if your magnesium is magnesium oxide, you're absorbing roughly 4%. Your muscles aren't getting what they need. Let me give you the 3-part solution. Each piece addresses a specific part of the problem. The first is magnesium glycinate. I've brought this one up in other videos in this series, and I'll keep bringing it up because it's that important and that consistently misunderstood. When a balance correction signal comes down from your brain telling your calf muscle to fire and stabilize your ankle, magnesium is part of what lets that muscle respond quickly and release cleanly afterward. Without enough magnesium inside the cell, your muscle responses are slower, less accurate, and slow, sloppy muscle responses mean more stumbles, more close calls, more fear. Magnesium glycinate gets into your cells at an 80 to 90% rate. It's a completely different level of supplementation. The second is vitamin D3 as cholecalciferol, not D2, not ergocalciferol. Cholecalciferol is the form that's identical to what your skin makes from sunlight. Vitamin D3 receptors are found throughout the nervous system and in skeletal muscle tissue. Deficiency, which affects a huge portion of adults over 60 who don't spend much time outdoors, is directly linked to slower muscle reaction times, higher fall risk, and reduced nerve signal speed. The therapeutic dose range for adults with documented deficiency or active neurological symptoms is 3,000 to 5,000 IU daily, always taken with your biggest meal because D3 is fat soluble and needs dietary fat to absorb properly. The A3 deficiency is linked to slower reaction times. Take 3,000 to 5,000 IU daily with your biggest meal for proper absorption. The third, and this is the one almost everybody is missing, is vitamin K2 in the MK7 form, not K1, which is the version found in leafy greens that handles blood clotting. Not K2, MK4, which has a very short half-life in the blood and needs to be dosed multiple times a day to do anything meaningful. K2 MK7 is the long-acting form, typically derived from fermented foods, that stays active in your bloodstream for up to 72 hours and works continuously to steer calcium away from soft tissue and into bone where it belongs. The dose that shows real effects on arterial and soft tissue calcification in clinical studies is 100 to 200 micrograms daily, taken alongside your D3 with dietary fat at your largest meal. Glutamine K2 is a traffic controller that tells calcium to head for your bones and teeth, where it actually belongs. Without enough K2 in the picture, that calcium doesn't go to your bones. It deposits in soft tissue, in arterial walls, in the tiny blood vessels that feed your peripheral nerves. The 3 and K2, MK7 are partners. They function as a unit. Magnesium completes the picture so your muscles can respond. Let me tell you about Harold. Harold was 70 years old and had fallen 3 times in 14 months. The first fall happened in the garden. He brushed it off. The second was in the kitchen. He didn't tell anyone about it for a week. The third was on the front steps of his own house. Middle of the afternoon, broad daylight, on a surface he'd walked across thousands of times. That third one changed everything. He hadn't broken anything physically, but something had broken anyway. Harold had stopped going outside on his own. He'd stopped walking to the corner shop he'd been visiting every morning for 11 years. He told me in our first appointment that he felt like his body had become something he couldn't trust anymore. He said it the way people say things they've been sitting with for a long time, quietly, looking at the floor. His GP had sent him to physiotherapy after the third fall. The physio gave him balance exercises and a walking frame to use outdoors. Harold used the frame once, felt humiliated by it, and left it sitting in the hallway. We made 3 changes. Bumped his D3, added K2, MK7, and swapped his magnesium for glycinate. And I told him to keep doing the balance exercises the physio had given him, because the exercises weren't wrong. They just hadn't had the nutritional foundation underneath them to produce real results. 2 weeks in, Harold described something he called strange. He said his feet felt more connected to the floor, not a dramatic shift, not some kind of transformation, but more there, more present. He compared it to a phone signal going from 1 bar to 3, not perfect, but meaningfully better. At 6 weeks, his daughter called me. She said he'd walked to the corner shop, by himself, no frame. She said he came home, sat down at the kitchen table, and cried. She was calling because she didn't know how to thank me, and I told her the thanks belonged to Harold, who'd been patient enough to let his body have the time it needed. At 3 months, Harold was walking every morning, 20 minutes, the same route he'd taken for 11 years. He told me he still watched the pavement. He probably always would, but the fear was different now. It was caution, not paralysis, and that, he said, was enough. Here's your protocol. Write it down. Step 1. Check your current vitamin D free supplement for K2 MK7. Step 2. Start D3 and K2 MK7 together with your largest meal, D3 at 3000 to 5000 IU, K2 MK7 at 100 to 200 micrograms, always with food that has some fat in it. Olive oil, avocado, eggs, nuts. Fat-soluble vitamins need fat to absorb. Taking them on an empty stomach kills their effectiveness. Step 3. Replace your magnesium. If you're taking magnesium oxide, stop. Switch to magnesium glycinate, 300 to 400 milligrams. Take it in the evening, about 45 to 60 minutes before bed, so your muscle magnesium levels are at their peak during the overnight hours when your muscle tissue does its repair work. Step 4. Get your D3 level tested. Aim for 50 to 70 nanograms per milliliter for optimal nerve function. Step 5. Be patient. Nerve tissue doesn't turn around in 2 weeks. 6 weeks is where you see the real difference. Please take these warnings seriously. If you're on blood thinners like warfarin, talk to your doctor first. If you have kidney disease, magnesium glycinate at higher doses also requires your doctor's involvement, because compromised kidneys may not be able to clear excess magnesium efficiently. If your balance problems showed up suddenly with headache or vision changes, see a doctor right away. If this video gave you something useful, send it to someone who stopped going outside alone. They might not know there's another answer out there. Give them this one. Leave a comment below, your age, your country, and whether your balance has changed in the last couple of years. I want to hear from you. Subscribe so you don't miss what's coming next. Take care of yourself. I'll see you in the next video.